Heluna Health started up as an entity right around the time that the war on poverty was getting started in the 1960s. At that time, there was great political will to really try to tackle poverty in a collective and collaborative way. In that context, Heluna Health began as an outgrowth of the Los Angeles County Department of Public Health. So they spun off a nonprofit organization to be able to partner on public-private consortia to start new innovative models of addressing community health. At the same time, a very large and successful public program called the WIC program was beginning.
The WIC program is one of those very unique government programs that combines a healthy food prescriptive package with nutrition education. And the mission of our WIC program is to nourish, educate, support, and empower our clients and ourselves.
WIC stands for Women, Infants, and Children, and it's a special supplemental nutrition program for women, infants, and children in this country. We took on supporting and partnering and delivering that WIC program.
It's been like a marriage with Heluna Health. It's so comforting to know that they've got our back.
WIC has grown tremendously across the country, and the organization grew also by growing its WIC program in addition to the other innovative health programs that it was undertaking at the time. Our mission is to enable population health initiatives to improve the overall health and well-being of our country and our communities.
At the core, we help to empower and enable our partners that we work with to really focus in on what they do best, which is basically focusing in on their mission.
We have over 500 projects at any given time where we are partnering, where we are delivering direct services, and we're providing administrative and fiscal support for these entities or these projects that are impacting over 39 million lives across both the U.S. and sometimes internationally. We provide services for at-risk youth. We work in homeless services. We work in communicable disease and disease surveillance. We are involved in chronic disease prevention and outbreak preparedness and response. So we're really active across the population health spectrum.
YDS is Youth Development Services. Our primary goals are gang intervention services and to interrupt the cycle of violence that occurs throughout the city.
One of the main things we do is we're peace promoting. We haven't had a gang-related incident in about 6 months. And in the year, it's been maybe 3. So us being out there and us promoting peace has been extremely effective.
Heluna Health helps provide the infrastructure, but also does the direct project management that help the supervisors manage the program more effectively, and thus having a higher chance of success rate, higher potential number of clients running through the program, as well as graduates from the program.
Partners come to us for many different reasons and for a set of different services. We are a very flexible organization, and so we try to work with partners to best understand, identify their needs, and build a program that matches their need.
Primarily, Heluna Health provides a client service team that looks at 3 areas: fiscal management, contract management, and human resources. Not all of our partnerships are that way, and we have custom solutions where we are able to meet them at their need. The inception of a lot of organizations that are working in the realm of population health is a mission to make an impact and to affect change. And a lot of times, organizations are held back from doing that because they have to deal with an administrative burden. By Heluna Health partnering with these organizations, we are able to alleviate that.
Heluna Health helps us do a better job of accomplishing our mission because they take away a lot of that admin work that takes a lot of time and allows us to focus within the community that we serve. The Soul Project advocates for smoke-free, healthy communities as a result of the targeting of the tobacco industry to African American populations, youth populations, low-income populations.
One of the main things that is always said is like, oh my gosh, you guys make that so much easier. I thought it was gonna be so difficult. I thought it was gonna take us forever, and we're done. They're appreciative of the fact that we're able to handle things and address it quickly.
Our partner was at risk of closing their doors, and we needed to find a partner very quickly who could work with us to take on this massive responsibility of transitioning more than 60 employees and ensuring that 300 individuals who were living in our shelter system would not be displaced. And by the way, we need you to do this within the next 30 days. Heluna Health did not blink an eye. They said, okay. We will do this within 30 days. And within 30 days, we had a wonderful new partnership with Heluna Health that still exists today. Heluna Health supports our shelter system of care. They are partners to provide the delivery of our outreach services through the core teams. And Heluna Health also are our partners in delivering the supportive services that we deliver every single day to those persons who are in our permanent supportive housing programs.
A wonderful example of one of our direct service programs is Little by Little, which we developed to address a clear need surrounding early literacy in the community.
The way the Little by Little program works is parents come into our WIC office for their usual WIC appointment. And while they're with us, we let them know that they get free books when they come to WIC now. We talk about the importance of early childhood literacy and the importance of school readiness.
If we provide those enriching early literacy experiences while we have them in the WIC site, we're seeing increases and improvements in kids' readiness for school at age 4.
There's no doubt that our work at Heluna Health is impacting at least 39 million lives that we touch. There is much that we are doing to impact the health and well-being of our communities, and we look forward to doing that in a more robust and ever more impactful way in the years ahead.
Heluna Health has definitely made its mark in the last 50 years, especially with its WIC program being the largest in the nation, and it has reached hundreds of thousands of people in nutrition and breastfeeding services, which is one example of a really far-reaching impact that we've had. The same with our housing and homelessness programs in Northern California. It's really inspiring that Heluna Health is so well positioned to have an impact in that area.
We've been doing this a long time. We're celebrating our 50th anniversary this year, serving the community, and that's an amazing accomplishment.
We started out serving the needs of our local community, and over time, over the past 50 years, we've grown tremendously. We've grown to address projects and programs not only across the country, but in some cases across the world. I see in the future that we are coming to increasingly play a role as a thought leader in how we develop a true system of population health in this country, so that we are not just addressing individuals' clinical needs in a kind of reactive fashion, but proactively, we are playing a role so that all entities think about health and wellness in a way that can minimize the burden of disease in this country. And we intend to play a very active role in that capacity, shifting the landscape, shifting the policy, and working with our partners to execute those structural changes.